Your feet might be sending warning signs of diabetes right now, and you do not even realize it. From numbness to strange skin changes, these symptoms often appear early but are dangerously ignored. In the next few minutes, discover 8 critical signs you should never overlook. Most people believe that diabetes can only be caught by a blood test. You go to your doctor, the lab work comes back, and that is when you find out. I understand why people think that. For years, that is what most patients told me too, and I have been practicing medicine for over 10 years. And what I have learned, what I see confirmed in my office every single week, is that your body starts warning you about high blood sugar long before any lab result ever would. And the very first place your body speaks up is your feet. The reason I am making this video today is because of how many patients I have seen walk into my office, or worse, walk into an emergency room, who had every warning sign sitting right there on their feet for months, sometimes years before the diagnosis came. They missed the signs not because they were careless. They missed them because nobody ever taught them what to look for. That changes right now. Before we go to the 8 signs, I need to give you the foundation. Because once you understand why diabetes speaks through your feet first, you will never look at your feet the same way again. Here is what happens inside the body when blood sugar stays too high for too long. Glucose is the fuel your cells run on. When insulin works properly, glucose enters your cells and powers every function in your body. When blood sugar is consistently elevated, either because insulin is not working or because the body is not making enough, that excess glucose circulates in the blood and begins damaging things along the way. The first things it targets are the smallest and most delicate structures in the body. The tiny blood vessels called capillaries and the fine nerve fibers called peripheral nerves. And where are the highest concentrations of both? The feet and the lower legs. This is why feet are the early warning system for diabetes. The damage starts there first. The nerves that tell you when something is hot, cold, sharp, or painful begin losing their sensitivity. The blood vessels that carry oxygen and nutrients to the skin, the muscles, and the tissues of the foot begin narrowing and weakening. The immune response in the feet becomes slower and less precise. All of this happens quietly without any dramatic symptom at first, just gradual changes that most people dismiss as normal aging, tiredness, or poor footwear. They are not normal. They are the body sending you a message, and every one of the 8 signs I am about to share with you is rooted in this exact biological process. Let me tell you about a patient I will call Samuel. Samuel was 58 years old, a retired engineer. He came to me not about diabetes, but about a sore on the bottom of his left foot that was not healing. He had first noticed it about 3 months earlier. It was not particularly painful. It was not obviously infected. He had just assumed it was a blister from old shoes. He had put a plaster on it and tried to ignore it. When I examined Samuel's feet that day, I found far more than a slow-healing sore. His feet were telling a story that had been developing for at least 2 years, a story he had not known how to read. His blood test confirmed type 2 diabetes with a blood sugar level significantly above the diagnostic threshold. He had had no idea. We will come back to Samuel because the conversation we had that day about what his feet had been showing him for years is exactly the conversation I want every person watching this video to be equipped to have with their own body. Sign number 1. Numbness or tingling in the feet. This is the most common early sign and the one most frequently dismissed. High blood sugar damages the peripheral nerves over time. This damage is called peripheral neuropathy. The nerves that carry sensation from the feet to the brain begin to malfunction. The first symptom is almost always an abnormal sensation, either a numbing feeling where the foot feels less responsive than it used to, or a tingling sensation described by many patients as pins and needles that come and go without any obvious cause. Many people assume this is from sitting in one position too long, from poor circulation unrelated to blood sugar, or simply from getting older. All of these can cause similar feelings, but when the tingling or numbness is regular, when it is specifically in the feet and toes, and when it does not fully resolve with movement, it needs a proper medical evaluation. Do not wait. This nerve damage is progressive. The earlier it is caught, the more of it can be stopped. Sign number 2, burning pain in the feet, especially at night. This is numbness's more dramatic counterpart, and it affects a significant proportion of people with undiagnosed diabetes. Damaged nerves do not only lose sensation, they also misfire. When peripheral nerves are damaged by sustained high blood sugar, they sometimes begin sending pain signals to the brain even when there is no physical injury. The result is a burning sensation in the feet and soles, often described as feeling like the feet are on fire, particularly in the evening and at night, when there are fewer distractions from the sensation. This is called neuropathic pain, and it is one of the clearest clinical signs of established peripheral nerve damage from prolonged high blood sugar. If you are experiencing burning foot pain that is worse at night and not explained by an injury, a skin condition, or footwear, get your blood sugar checked. This symptom is telling you something specific. Sign number 3, slow healing sores, cuts, or blisters on the feet. This was the sign that brought Samuel to my office, and it is one of the most medically serious on this list. High blood sugar damages the small blood vessels that deliver oxygen and nutrients to the skin and soft tissue. When the blood supply to the foot is reduced, the healing process slows dramatically. A small cut that would normally close in 2 or 3 days in a healthy person may take weeks in someone with uncontrolled blood sugar. A blister may not resolve. A small wound may slowly become larger rather than smaller. There is a second problem layered on top of this. Because neuropathy reduces sensation, people with diabetes often do not feel the initial injury at all. They do not feel the cut happening. They do not feel the pressure of an ill-fitting shoe creating a blister. They discover the wound later when it has already had time to develop. Any wound on the foot that is not healing within 2 weeks needs immediate medical evaluation, not in a few more weeks now. Diabetic foot complications are one of the leading causes of lower limb amputations worldwide. Most of those amputations are preceded by a wound that was not taken seriously early enough. Sign number 4, swelling in the feet and ankles. Mild swelling in the feet and ankles at the end of a long day can be normal. What is not normal is swelling that is persistent, present first thing in the morning, or that appears alongside any of the other signs on this list. Diabetes affects the kidneys over time, reducing their ability to regulate fluid balance efficiently. It also affects the small blood vessels in the legs, reducing their ability to return fluid from the tissues back into the circulation. The result is fluid accumulation in the lower legs, ankles, and feet. Persistent swelling in the feet, combined with any other sign on this list, is a strong reason to get a full diabetes screening done. Do not treat this symptom in isolation with compression socks and elevating the legs without first finding out whether blood sugar dysregulation is the underlying cause. If you have made it this far, you are clearly invested. You want to see what happens next. But most viewers enjoy the content and scroll away without subscribing. If this one really means something to you, tap subscribe. It takes a second. If not, you will probably forget this channel exists and miss a lot of great educational content ahead. Sign number 5, changes in skin color on the feet or lower legs. The skin of the feet and lower legs is one of the most reliable indicators of circulatory health. When the blood supply to this area is compromised by diabetes-related vessel damage, the skin begins to change in appearance. Look for any of these specific changes. A reddish, brownish, or purplish discoloration that appears on the lower leg or foot without any bruising or injury. Skin that appears shiny, stretched, or unusually thin. Areas that are noticeably paler than the surrounding skin, particularly on the toes or the ball of the foot. Dark patches in the skin creases, particularly around the ankles, which can indicate a condition called acanthosis nigricans, strongly associated with insulin resistance. None of these changes are cosmetic. Each one reflects something happening in the blood supply or the metabolic environment of the tissue. Any unexplained change in skin color on the feet or lower legs deserves a medical assessment, not a cream. Sign number 6, dry, cracked skin on the feet. Healthy skin on the feet requires adequate circulation to stay properly moisturized from within. When circulation is reduced by diabetes, the skin loses its ability to maintain normal moisture levels and begins to dry out, harden, and crack. This is more serious than it appears. Dry, cracked skin on the feet, particularly around the heel and the ball of the foot, creates entry points for bacteria. In a person with reduced immune response from high blood sugar and reduced blood flow from vessel damage, a small crack in the skin can become an infected ulcer within days. The combination of dry skin, reduced sensation, and impaired healing is one of the most dangerous patterns in uncontrolled diabetes. If your feet are persistently dry and cracking despite regular moisturizing, and particularly if you have any of the other signs on this list alongside it, do not accept this as normal dry skin. It may be part of a larger pattern. Sign number 7. Loss of hair on the lower legs and feet. This sign is often completely overlooked because people do not associate hair growth with diabetes or blood sugar. Hair follicles require a healthy blood supply to function. When the small blood vessels that feed the lower legs and feet are damaged and narrowed by sustained high blood sugar, the hair follicles in these areas receive insufficient nutrients and oxygen. Over time, they stop producing hair. The result is a gradual, progressive loss of leg hair from the knee downward, particularly noticeable on the lower shin and the top of the foot. If you or someone you love has noticeably less hair on the lower legs compared to the upper legs, and this change has happened gradually over months or years, it is worth discussing with a doctor in the context of a full metabolic screening. This is one of the most specific and under-recognized signs of peripheral vascular compromise related to blood sugar damage. Sign number 8. Foot deformities or changes in foot shape. This is the most advanced sign on this list, and it indicates long-standing nerve and tissue damage that has been present for some time. When the nerves that control the small muscles in the foot are progressively damaged by diabetes, those muscles weaken and stop working correctly. Over time, the muscular balance that holds the bones of the foot in their proper positions is disrupted. The toes may begin to curl into a hammer toe or claw toe position. The arch of the foot may collapse or change shape. The ball of the foot may develop a hard, pressured area that does not respond to padding, a condition called Charcot foot, where the bones of the foot begin to weaken and fracture because the person cannot feel the pain that would normally protect the foot from excessive stress, can develop in people with long-standing diabetic neuropathy. This is one of the most serious diabetic foot complications, and it requires urgent specialist care. Any progressive change in the shape of your feet as an adult, particularly alongside numbness, reduced sensation, or poor wound healing, needs immediate medical evaluation. I promised I would come back to Samuel. After his diagnosis, we put him on a structured management plan: medication to control blood sugar, dietary guidance, regular foot examinations every 3 months, proper footwear education, and most importantly, daily self-examination of his feet. 18 months later, the sore on his foot had long healed. His blood sugar was well controlled. The numbness in his toes, which we discovered he had been experiencing for over a year and dismissing as poor circulation from his office chair, had stabilized and, in some areas, improved. He told me something I have thought about many times since. He said, "Doctor, my feet were screaming at me for 2 years. I just did not know the language." That is exactly it. Your body speaks. The feet speak first with diabetes. The language is specific. You just need someone to teach you the words. That is what this video has done today. Let me bring this all together clearly. 8 warning signs in the feet that can indicate diabetes long before a blood test confirms it. Numbness or tingling that does not go away. Burning pain, especially at night. Slow healing wounds or sores. Persistent swelling in the feet and ankles. Unexplained changes in skin color. Dry, cracking skin despite regular care. Loss of hair on the lower legs and feet. And progressive changes in the shape of the foot. You do not need to have all 8 signs. 1 or 2 of them appearing consistently is enough reason to see your doctor and ask specifically for a fasting blood glucose test and an HbA1c test. Ask by name. Do not accept a general checkup and assume diabetes was ruled out. Ask specifically. Here is your action step right now. Take off your shoes and socks and look at your feet properly for the first time in a while. Look at the skin color, the texture, the toes, the heels. Check for any sores or areas that feel different from the rest. Then, think about the last time you experienced any of the 8 signs I just described. If anything on this list applies to you, do not wait. Book an appointment with your doctor this week. Which of these 8 signs did you not know before watching this video? Tell me in the comments. I read every single one. And if someone in your life has any of these signs right now, please share this video with them today. That one share could be what gets them to a doctor before the damage becomes irreversible. Subscribe to this channel for more honest, clearly explained medical information about the health topics that matter most after 50. The conversations your doctor does not always have time to finish. I will finish them here. Your health deserves the full picture. Disclaimer: everything shared in this video is general medical information based on published clinical research and medical practice guidelines. It is not a substitute for personal medical advice. The presence of one or more of these signs does not confirm a diabetes diagnosis. Only a qualified medical professional can diagnose diabetes after proper testing. If you have concerns about any of the signs discussed, please make an appointment with your doctor and ask for appropriate blood sugar testing.